As we've heard earlier, the Food and Drug Administration has greenlit the Pfizer vaccine for emergency use. It's a game changer for the fight against coronavirus. Let's welcome in Ashish Jha. He is the Dean of Brown University School of Public Health and a professor of health services policy and practice. Good morning, sir. How are you?
Good morning. How are you?
All right, so got some questions about this. This has been a large point of contention. I am largely skeptical about a vaccine. I'm not saying we shouldn't take it. I'm saying I'm skeptical in these short-term trials and things like that. What do we know about this vaccine, and how soon will it be able to be distributed to the high-risk people across the country?
Yeah, so it's a great question. So let's talk about the vaccine and what has happened so far. Every vaccine goes through a series of checks, a series of steps, clinical trials, safety checks. All of these vaccines, the Pfizer one, the Moderna one, have gone through every step. So we haven't skipped any of them. We've had a 45,000 person clinical trial for the Pfizer vaccine, really pretty unprecedented. So I feel very confident looking at the data that this vaccine is safe and it's obviously very, very effective. You know, in terms of the distribution, we got to make millions and millions of doses. Some of it is going to start getting out this week and next. Most Americans won't be able to get access to the vaccines until probably March or April. But the high-risk individuals and frontline folks should be able to get it in maybe later this month, but probably more January or February.
Yeah, will you take this vaccine, sir?
Absolutely. The first day that I am eligible, I'm rolling up my sleeve. I have elderly parents. I've told them that as soon as they hear that they can get it, they're going to get it. And then I'm going to wait a little bit on data for kids because that stuff is still being collected. And so my children will probably get vaccinated a little bit later in the spring when we have more data on children.
Right. Now, this is one of many vaccines, but there will still be a need for social distancing, face masks, and things like that. Arguably, how soon can we go back to normal in the U.S.?
Yeah, so I see it as kind of a glide path to normal, meaning there will be some high-risk things. Like imagine the super packed concert hall. Well, that may take a little while before we can do that safely without wearing masks. But I think as we get into the spring and summer, I think lots of outdoor stuff, we won't need to wear masks. Social distancing will become less necessary, certainly once we've gotten 70, 80% of people vaccinated. So I am looking forward to a glide path. Things will get back to a new version of normal as we get into the spring and summer.
Now, I want to talk to you a little bit about COVID fatigue. And I myself, I wear a mask almost nowhere unless I'm, with people that I respect, that I am trying to keep safe and things like that, that they request me to put on. Okay. I always said from day one, people should be respectful about this. However, you have a number of people, especially people who are going to the doctor's office and getting this Q-tip stuck 3 or 4 inches up their nose to get to a virus that is so allegedly so contagious that it is shutting down our economy and forces us to wear masks and keep 6 feet apart. And people have said, my business is shut down. Here in New York City, they've just shut down indoor dining. People are getting really fed up. And at some point, they're going to start pushing back. They already have. What do you see the COVID fatigue looking like?
Yeah, I totally get it, right? It's been a long time. It's been 9, 10 months. It's been on and off. Here's what we know from places that have done a good job controlling the virus. If you do a good job controlling the virus, you can open up the economy much more. When you let the virus run wild, as it is running in many parts of the country right now, it's very hard. Once the hospitals get full, and whether you have COVID or something else, you can't get hospital care, that's when you really do start having a negative effect on the economy. And we've seen this over and over again. So what I say to folks is, we're in the home stretch, really tough couple of months, but let's get through it. I've been pushing for supporting small businesses. We don't want them shut down forever. Let's get through the next couple of months, and then things will really turn around as these vaccines get out.
Yeah, I mean, it's a very difficult thing when you see so many people that are literally suffering. The government, I don't want to go into politics with you, sir, because that's not your thing. But when you have people seeing the very people shutting down their businesses are still getting their government paychecks. However, these businesses are not. So when people get these vaccines and they start to see it hit the open market, whether they get one themselves or not, do you think they're going to have a bit of complacency on it, though? That is a worry.
Yeah, I worry about that, too. And I think this is why we have to make sure that, again, the high-risk people get vaccinated first, people who are older, people with chronic diseases. Obviously, we want our first responders, firefighters, police officers, frontline healthcare workers to get it first. After that, I want to make sure that we really distribute this in a way that there isn't somehow a black market or for that. And then also, I want to make sure that people understand that it is safe and effective. And when it's your turn, You should get vaccinated. It's good for you and it's good for your family. You protect other people when you get vaccinated.
Do you think, sir, one last question, do you think it should be mandated that people take this?
I don't see the government mandating it. I don't even know if they have the right to mandate it. But I do see private businesses. I've been talking to a lot of private businesses. They basically are saying, airlines are saying, look, you want to get on an airplane, on our airplane, you have to be vaccinated. So I think private businesses have a lot more leeway in our country. They have a lot more freedom to run their business as they want. I see them doing a lot of mandates. I don't see the government putting in a statewide mandate on vaccines. I don't think that'll fly.
Dr. Ashish Jha, thank you very much for your time, sir. We appreciate it.